Well, good morning. My name is David Shirk, and maybe you could share your name and what you're doing at Kijabe Hospital.
Good morning. My name is Etienne Mastaki Alemi. I'm a resident in anesthesia in Kijabe.
Excellent. And where is home? Where do you come from?
So I'm from Republic Democratic of Congo. I've been here for 1 year and 9 months for
Okay.
now. Yeah.
Excellent. I guess in America on a map we call it DRC.
Yeah.
But tell me about your home. Tell me about maybe the country and then also your part. It's a huge country, right?
Yeah, DRC is a huge country. It has around 26 county.
Mm-hmm.
I'm from the eastern part.
Okay.
In the Ituri province. So you can in Kenya we can say Ituri County.
Okay.
Yeah, it's in the border with Uganda.
Okay.
Yeah.
Okay.
So I'm
Oh,
not
so
far from the border.
you're a
Yeah.
neighbor to Kijabe.
Yeah.
Good. Or
Yeah.
to Kenya.
Okay.
And so languages. Did you know any Swahili before coming?
Yeah, I know some Swahili, but it's not the best Swahili like in Kenya. But I can hear what people are saying in Kenya.
Yeah.
I can talk.
Well, even Kenya is not the best Swahili.
Okay.
I think Tanzania is the good Swahili, and then they give us a hard time for how we speak.
Okay.
Yeah.
Yeah, so I can talk French, Swahili. My English is not the best, but yeah, I'm trying English and some DRC language like Lingala and others. Yeah.
Wow, that's awesome.
Yeah.
Was that a big adjustment? Because I guess medical. Well, what was your training? What was the primary? Was your medical training in English or French?
My medical training was in French.
Okay.
It was not easy in the beginning. Yeah, it was a huge adjustment with the language.
Yeah.
Yeah, but yeah, with God help, we are trying to do our best.
Yeah, absolutely. And this is for people watching this. You know, people are literally around the world, but this is it's a big challenge when we think about being a training hub for all of Africa. You know, how do we welcome people, and then how do you adjust? How does everybody succeed and do well? How is training going? How is anesthesia?
Training is going well. I think it was the best choice of my life. We have the wonderful consultant. Kijabe is a good place for learning. So training is going well.
Maybe tell me about your medical background. Why did you want to come here and study anesthesiology?
Okay, thank you very much. It's a very good question. I did my medical school in DRC in Goma City. So I graduated in 2015. After that, I did 1 year of internship in Nyakunde Hospital. This is in the area where I'm from, in the Ituri County. Then I...
So you know Dr. Kupra?
Yeah, I worked with him.
Good.
Like one year, I think.
Excellent.
I met him there in Nyakunde.
Excellent.
Yeah, so after that, I worked in a missionary hospital called the Itende Hospital for like 3 years. Unfortunately, in 2021, my hospital was banned with the rebels. They came, they destroyed everything, and I was jobless for like 2 years. Then I met a doctor, a surgeon from PAACS. He's called Dr. Jacques Ebele.
He's now in Malawi?
He's in DRC now.
Oh, he's back in DRC.
Yeah, he's
Okay,
back in
good.
DRC.
Okay.
And I worked with him like for 1 year. And after that, he's the one who talked to me about PAACS.
Yeah.
Yeah, and I had some options. Anesthesia, I was trying to think about radiology, but he convinced me to do anesthesia.
Oh, yeah. Excellent. What were the capabilities at these hospitals you were at in DRC, at Nyankunde and then the other mission hospital?
Yeah.
It's like, you had theaters?
Yeah, we had theaters.
You had some anesthesia machines.
Yeah,
were there anesthesiologists?
No,
or nurse anesthetists?
I've never met an anesthesiologist before.
What?
Yeah. So it's my first time
my
to
goodness.
meet anesthesiologist in
Wow.
Kijabe. Yeah.
And so who would provide anesthesia? Would there be nurses who were trained?
Nurses, yeah.
Okay.
Nurses.
Yeah. And had they
Nyakunde.
done formal training, or they just kind of
Yeah,
learned?
they have formal training.
Okay.
They have like 3 years of training.
Okay.
Yeah,
Okay.
they are
Yeah.
doing it, yeah. Nyakunde is the biggest hospital in my area.
Yeah.
It has, I think, a capacity of 250 beds
Yeah.
with 4 theaters.
Yeah.
Yeah.
So what is the difference between somebody doing nurse anesthesia and a trained anesthesiologist?
Okay. So with 2 years that I'm in anesthesia, I think the difference is just some skills like difficult airways, people blocks, and a lot of physiology, pharmacology. So it's making the difference between a nurse anesthetist and anesthesiologist. So for the nurse anesthetist, it's most of the time the practical things.
Mm.
Yeah, but yeah, the anesthesiologists have to do critical care, and they have to combine with the anesthesia skills. Yeah.
Tell me about faith. I guess your background is in mission hospitals. What does it mean to integrate Christian faith and medicine and what you're trying to learn and what you're trying to provide?
Yeah, so I'm lucky to be born in a Christian family, and also my father is a nurse actually.
Oh wow!
Yeah, so I was raised in an environment where we are going to the church, and I was seeing my father going to the hospital. So all this environment, I think, had a big impact on me to go in to do the medical school. But I think the healthcare is actually the great environment for spreading the gospel, because when people are coming to us, they are anxious, they are weak, and most of the people when they are sick, they want to look for God. They want to look the face of the God, because we are African. Some people can come to the hospital, others are going to see other people in the village. There are those who are going to the church. They want people to pray for them so that they can be healed. So I think the healthcare environment is really a good opportunity. And I think it's 2 months ago we had the opportunity to learn about the saline process. I think it has brought something for us to continue to talk about the gospel to our patient and to help them even physically, mentally, and spiritually.
And so saline, can you explain a little bit?
Some people have sat together and they thought that it's better to combine the spiritual care with the health care, and they give us some formula that can help us to talk to our patient. When we are taking the medical history, we can easily talk to them about their faith and to know how they are doing. Yeah.
Awesome. And so how would you could paint a picture of how you might use that with a patient? Like if you're talking to a patient,
yeah,
like what might you say?
Yeah, there is a small formula we call FICA. FICA, F is going for faith. You can ask them, do you have a faith? Do you believe in my God? And I is you are asking them is they think it's important for them to have faith. C is going for community. Are you going to a church? Is there a community where you are involved to discuss about your faith? And the A, if the environment, the family, they have the family, you can discuss about people are coming to visit you as you are in the hospital and all those things. That small formula is just, I think, 1 minute and you are done.
Yeah. And is that how interesting? Is that something that goes on the chart now? I heard talk about like incorporating this into HMIS.
For now,
about
not really.
Yeah,
but
okay.
in our program director, Dr. Matt has initiated a spiritual round. So each Tuesday we are meeting in the morning we are sharing about our patients, if we have had some discussion about their faith. So yeah.
Oh, that's really cool.
Yeah, and I think next year they are going to try to do something with those who are coming first year, to talk to them more about the saline process. And we have a project maybe to try to incorporate it in our anesthesia chat, so that it can facilitate that as well when we are doing pre-op, to quickly review the fifth part with our patient.
Wow.
Yeah.
That is so good. I love that.
Okay.
So I guess I should ask you about housing. I guess so right now we're prioritizing our residents and fellows coming from other countries.
Yeah.
So you're on campus right now, but then a lot of your colleagues live elsewhere out in the community. Is that right?
Yeah, even me, I was providing housing for 1 year.
Oh, okay.
So now I'm living outside of the campus.
Okay.
Yeah.
Yeah. So you're commuting in.
Yeah.
Was that stressful? Sort of
Yeah,
housing?
it's stressful. It's stressful because every morning you have to leave like 5. You are coming if it's raining. Sometimes the case can take long, and we are leaving late, like 9, 10 p.m. It's stressful to leave the hospital and to go back home. Yeah, it's really stressful.
And so in anesthesia, you're first in, last out, right? Is that I don't know if you think about it that way, but
Yeah.
because before a patient comes into surgery, like you have to do pre-op, make sure that they're safe to go into surgery, and once they're sutured up, the surgeon can go, but then you have to make sure they're safe in PACU. They can transfer out to the ward. So you're the first and the last.
And the last, exactly.
Yeah. Wow. Well, hopefully we're making progress on this project. So I think if God willing, maybe this time next year you could have a new home back in Kijabe. So that's what we're hoping and praying for.
Yeah.
Yeah. Well, anything else we should talk about? Anything you would like to share with our friends of Kijabe, people who might be watching this around the world?
We want just to thank them with their beautiful work. They are really doing a good thing, and through what they are doing, I think they are saving Africa, because we are coming from all over of Africa to learn and to go not only to save the life of the people in the medical care, but also spiritually and so many things. So through PAACS, you are doing a great job, and I can assure you that the fruit of your work is all over Africa. Yeah, may God bless you.
Oh, that's awesome. Mastaki, thank you so much. I appreciate it.
Yeah.
This is great.
Thank you very much.